So today's topic is skull. How many bones in skull? What is skull? First, skull is a bone protective cavity for the brain and composed of total how many bones? 29 bones. How they are? Let's discuss. Composed of four types of bone. Is that first one is cranial, second is facial, third one is ear bones, fourth one is hyoid. Now understand, skull is a bone protective cavity for the brain and composed of four types of bone: cranial bones, facial bone, ear bone and hyoid bone. And how many cranial bones are there? 8 cranial bones. 8 cranial bones. First we will discuss about, and there is differentiate between two types: paired bones and unpaired. How many cranial bones? Total 8 bones. How many bones are there? 8 bones. And how we will differentiate paired and unpaired? Paired bones are two: parietal and second one is temporal, like this. This is nose, this is this is temporal, this is parietal. Both are paired bone and unpaired bone. First one is, this is frontal, and this one is occipital bone, and third one is sphenoid and ethmoid. There are one in number and there are 2 in number. Complete 8 bones. We are talking about skull is a protective cavity composed of 4 types of bones. First one is cranial bone and second one is facial bone. Facial bones. How many they are? They are in 14 in numbers. Means paired also and unpaired also. Paired and unpaired. Second one is facial. unpaired. Which one is paired? Maxilla, zygomatic, nasal, lacrimal, palatine, and inferior nasal concha. Lot of students are asking me that what about the superior and middle nasal concha, but you know that, make a note, superior nasal concha and middle nasal concha is a part of which bone? Ethmoid bone. And now we are, how many there are? There are 2 maxilla, 2 zygomatic, 2 nasal, 2 lacrimal, 2 palatine, and 2 inferior nasal concha. And what about the unpaired bone? Unpaired bone is mandible, facial bone, and vomer. How many there are? Mandible, and mandible, you know the structure of the mandible, like this, and vomer is there. Okay, so let's revise this. Skull bones are how many bones? 29 bones. How we will differentiate? First one is cranial bone. Cranial bone is 8 and facial bone is 14 in numbers. 14. Now we will talk about third one is what is the topic of third one? We will differentiate them. First one is cranial. Second one is facial. How many cranial? Cranial are 8 bones and facial is 14. And third one is R bone. How many they are? 6 in number. Both ossicles, also called ossicles and cochlear bone, R bone and ossicles bone. Ossicles and in ENT they are calling cochlear bone. So how many they are in? They are in 3 plus 3. 3 is right and left. Okay. And fourth one is hyoid bone. Okay. This is all about skull. Skull is a bone, protective cavity for the bone, composed of 4 types of bone. Is that first one is cranial, facial, and hyoid bone. Cranial bones are 8 in number. Paired and unpaired. Paired bone is 2. 2 paired bone, parietal and temporal. Okay. Facial 14 are 6 and hyoid. Now we will discuss. We are further discussing about skull. How skull? We are discussing in skull there is sutures. How? Sutures. What is sutures? Sutures is a immovable fibrous joints between skull bones. Okay, so how? First one is sutures. How many sutures in there? Let's discuss. This is nose, ear, and this is, which bone is this? This is frontal bone. and this one is occipital. Now you tell me, occipital is a paired bone or unpaired bone? This is unpaired bone. This one is unpaired bone. And this is parietal bone. And there is temporal also. Temporal bone. We will discuss about it. And this one is coronal suture. And this one is sagittal. Sagittal suture. And this one is lambdoid. स्पेलिंग ध्यान से याद करना, लैम्बडॉइड सूचर. Now, so how a lot of students are telling that this is vertex area also, vertex also. Now we were discussed about how there is coronal suture. Coronal suture is made up of frontal bone plus 2 parietal bone. This is parietal, this is parietal, and this is frontal. Make this triangle. Why I am making this triangle, I will tell you later. This is sagittal suture. Sagittal suture between 2 parietal plus parietal bones, and lambdoid suture between 2 parietal plus 1 occipital bone. This is this area. Now I am making another diagram. Nose, and this is coronal suture, lambdoid suture, sagittal suture, and this is bregma. What we call bregma. Now we are discussing about in child skull. In child skull there is a sutures also there, but there is fontanelles. What is the meaning of fontanelles? Write a definition. The unossified membrane, unossified membrane gap in skull are called as fontanelles. How many they are? They are in 6 in number. Let's discuss about how they are 6 and why they are 6 in there. Why they are 6 in here. First one is anterior fontanelle. Now you understand what is the meaning of fontanelles. Fontanelles means the unossified membranes gap in skull are called fontanelles. And there is anterior fontanelle. Anterior is something there is in anterior. It means this is situated in anterior. First one is anterior and second one is posterior, just opposite of them. What is the called is lambdoid. This is called bregma and this is called lambdoid because this is situated in lambdoid suture. Posterior fontanelles. Now what about 1 and 2 and what about the 4 fontanelles? 4, it means third in number, but there is a 6, 1 and 2, and what about 4? So there is 1, 2, 3 and 4. They are called lateral fontanelles. Lateral means they are called antero, means they are in anterior side. Now we will call about anterolateral fontanelles, and they are in posterior. There are two in number. Posterolateral fontanelles. Now understand, there is a how many fontanelles? 6 fontanelles. Fontanelles means the ossified membrane gap in skull are called fontanelles. Anterior fontanelles, posterior fontanelle. Anterior fontanelle situated in coronal suture. In coronal suture and sagittal suture. How many bones are there? Frontal and two parietal bones. Sagittal suture, this one. Lambdoid suture, this one. Sagittal suture, 2 parietal and 1 occipital. Fontanelles are anterior fontanelle, posterior fontanelle, and lateral fontanelle. And how they are, why there is, and why they are important for us, fontanelles. And when there is closes, there is gap. I told you gap, but now we can feel in our skull there is no gap. But how and why they are closes, and in what age? Anterior fontanelle closes at 18 to 24 months after birth. It closes, and posterior fontanelle closes 2 to 3 months after birth, and lateral fontanelle suddenly after birth. It closes at anterior fontanelle closes at 18 to 24 months after birth, and posterior fontanelle closes at 2 to 3 months after birth, and anterolateral and posterolateral closes at suddenly after birth. Now, why these fontanelles are important for us, and how fontanelles are used to check hydration of child. First point, state of ossification of bones in child. Third one is state of IC pressure. IC pressure सबको पता है. IC pressure means intracranial pressure. So we were discussed about skull 29 skull bones, then how the bones are paired or unpaired. Facial bones, skull bones are 8, facial bones are 14, and third one is ear bones are 6, and hyoid bone. We all together just revise it, then you will remember whole things. Thank you.